All right, so I will share my screen. I have the PowerPoint. All right, so you see the PowerPoint?
Yes. And you
All right,
also sent it to me, so thank you.
you're welcome. Yeah, I posted it in the announcements. I was like, oh, we'll do that. All right, so the first thing that we need to understand is going to be the levels of prevention. All right, so what is primary prevention?
Education, teaching, preventative measures.
Right, it's a prevention, right? We're trying to prevent, right, disease or injury occurring. So absolutely correct. So um, nutrition education, family planning, sex ed, vaccinations, right, is another one. Smoking cessation, how to prevent, what's the word? Communicable disease, spread, which, a lot of that is going to be, vaccinations and stuff. Safety education, prenatal classes, trying to think of what else we would do for primary prevention. And then even for like, healthcare workers, right? Things like, proper body mechanics, hand washing, um, you know, and then like you go out into the community, like same thing with like restaurant workers, right? Just prevention. What's secondary prevention?
The three S's: screening, survey, surveillance.
Yep. So early detection and treatment, right, with the goal of limiting any severity as well as adverse effects, right? So what are some secondary prevention measures?
Um, like
Sorry.
STD testing, referrals for like follow-up care. Um,
Okay. What about things like your mammograms, your prostate screening, um, your pap smears, right, for cervical cancer, the hemoglobin A1Cs, right, for early detection of diabetes, monitoring blood pressures, right, to catch that hypertension early, lead exposures, and then of course, surveilling, like within community, right, looking at community assessments and like the disease surveillance, like do we have communicable diseases within the community? And then if there are outbreaks, right, then we want to try to control those. What is tertiary prevention?
After the disease is there or the condition, it is just health management for like a prolong of a healthy, fulfilled life. So like consistent testing, education on coming back to check like your viral load if you have HIV, implementations, dietitians, things like that.
Oh, yep. So it's reducing limitations of disability, right? Promoting rehab. As so again, maximization of recovery after an illness or an injury. And like, how to management of some of those chronic diseases as well. Um, it could also include case management, right? So some of our people that have like chronic illness, right? It could include case management. It could be your therapies like PT, OT, speech. It could even be like support groups as well. Um, so good job. Awesome. All right. So then we have our epidemiological concepts. So with those wonderful well, I can't even say epidemiological concepts apparently today is it's a struggle. The struggle is real for big words today. So we I don't know why it's just been I worked last night, so I slept all day. So maybe it's my brain just trying to like wake up. So the epidemiological triangle, we have host, agent, and environment, right? So agent is the physical, the infectious, or the chemical factor is that is what is going to cause the disease, right? The host is the living being that the agent or, or the environment influences. And then, of course, the environment is the setting or surrounding, right? So when we look at those, the interaction between the agent, the host, and the environment um, determines, whether we're going to develop the disease or whether or not, um, we can kind of stop it in its track, right? And so we have the common things. And so infectious, so like the agent could be bacterial, it could be viral, it could be a chemical agent, it could be physical agents, even like when we think of like excessive noise exposure, excessive temperature changes, that kind of thing. What are some things that make us as a host more susceptible to develop disease? Or I guess I'm just going to use disease as the word. What are some host factors that make us a little bit more susceptible?
Um, Having a chronic illness, having like a weakened immune system, having being pregnant, being young, having like predisposing qualities like diabetes,
Cool.
having like poor access to certain health resources, living in like third world countries where there isn't clean water or proper food.
Yeah. So all of those, right? The age, very old and very young, right? Generally are going to be more susceptible to things. Sex, genetics, even ethnicity, right? We know that ethnicity also predisposes to certain, illnesses and diseases. Your what's your immune status, right? So even think of like some of our chemo patients, right? Or people that are on, chronic steroid use for, COPD or some of those other, autoimmune disorders. Our physiological state too. Think about that, right? The higher, if we're living in high stress, right, then our body that has a huge impact on our immune system, and our job, right? Think about that,
Yeah,
right? For nurses, healthcare workers, and not just healthcare workers, but in general, healthcare workers were exposed to a lot of different things. Um, so, we have to kind of look at that and take those into consideration. So some of the terms associated with epidemiology. So we have endemic, we have uh, epidemic and pandemic. Um, so an epidemic, where we have like, a increase in the amount of, certain diseases. Um, So like, maybe we only have like, a certain percentage of the population that gets the flu every year and now all of a sudden it's higher. Or um, what if we have, we could have a outbreak of measles or mumps. I was just reading somewhere there was cases of measles. I was like, wow. Um, Pandemic. This is like an epidemic that, it involves more countries, more continents, right? Kind of, we think of COVID-19, right, was the big one for us. Um, I forgot what I was gonna say. Okay. What is vertical transition versus horizontal transition?
I'm not totally sure.
Okay. So vertical transmission is from, think of mom to baby. Okay, so it's parent to offspring. All right, so that would be your vertical transmission. Horizontal transmission, this is, something like the flu or the colds or even STIs. Okay. It's spread from person to person through contact, respiratory droplets, contaminated objects, that kind of thing, right? So vertical, think of parent to offspring, mom to baby, and then horizontal is, kind of community based, right? You're out and, people are colds and flus and we get sick. Um, what is active immunity?
Kind of like the act of getting sick, creating your own antibodies. When you get the live vaccine, you produce your own antibodies.
Very good, right? We produce our own antibodies in response to either infection, right, or immunization. What's passive immunity?
That's like mom to baby, or when you get the immunoglobulin. It's not immunoglobulin. It's when they give you the antibodies.
Right. So mom to baby, or if we do immunoglobulins, antitoxins, that kind of thing. Um, cool, good job. All right. Then we have our wonderful bioterrorism and our disease or disasters. So what do we know about anthrax?
We know that it is a biological weapon. I know that it can be like in a powder form. It causes irritation to the cause can cause severe respiratory depression. It irritates the skin. I know that the patient, we'd like immediately want to put them on oxygen, get them out of the dirty or covered clothing items. We'd want to make sure we're wearing like the appropriate PPE to protect ourselves.
Good job. So that HESI prep assignment's pretty all inclusive, right?
Yeah.
So yeah, so if we inhale it, right? Yes, we have the headache, the fever, the chills, the muscle aches, the chest discomfort, the shortness of breath, and they could go into shock. We do have an anthrax vaccine that is available for those that are high risk for exposure. Um, and then treatment is Cipro and uh Cipro and doxycycline. Sorry, couldn't remember the other one. Cipro, very common to give to anthrax victims. We also have antitoxins and IV antibiotics, right? That can be used. We look at level 1, 2, and 3 and phases of disasters. What's a level 1?
Level one is kind of like very local, maybe like a house fire or I just know something very small, like a very small situation relatively, something common that would be handled by the local departments, like the police or the fire department.
Very good. What's level 2?
Level two, I think, is more like a natural disaster.
Okay. Yep. All right. And level 3?
Level three would be like COVID, like a pandemic, where like variety of individuals are involved.
Right? Something like more, larger amount of people, right? More people are involved. What are the phases of a disaster?
What do you mean? Like,
So when we look at phases of the phases of disaster, I'm gonna pull up the HESI study guide. Was it on there?
it was, I think. Pretty sure it was. It's mine. Let me pull mine too.
So your phases of your disaster, your mitigation, your preparedness, response, and recovery. I don't remember if it was on the um I I'll pull it up in a minute. I don't want to waste I don't want to waste your time. Um, but mitigation. So we have mitigation, preparedness, response, and recovery. So those are the different phases of disaster. So during mitigation, this is where we are looking at long-term actions to prevent or not prevent, but to lessen the impact of a potential disaster. So think of, um, I don't know, how do we build our buildings to, withstand earthquakes or, hurricane proofing, housing, things like that. Like we're just looking at long-term ways to lessen the impact of a disaster.
Okay.
Um, Flood control systems. So like when I'll tell you like just an example. So where do you live, Kaylee?
I'm in Philadelphia.
Okay, so Philly, I'm from Brooklyn. Okay, so lots of bridges, lots of tunnels, right? Up in that
Yeah.
area, right? So, it's even like, how do we do better flood control systems, right? Although a lot of areas are surrounded by water, right? So like how come the tunnels don't flood when it rains? That, how do we kind of control that?
Gotcha.
The second phase is preparedness. So this is planning, this is training, this is, equipping, individuals, communities on how to respond to effectively to an emergency, right? So this is why we, tell families, right? They should have an emergency, what's the word? Like an emergency plan, like what to do in the case of a fire, what to do in the case of a, tornado, earthquake, hurricane, right? They should have drills, right? Families should have drills so that the kids, the parents, everybody knows what to do, where to go, right? Should something happen. As well as educating, those members and, members of the community about what are the potential risks. And of course, depending on where you live, right, the risks can be different, right?
Right.
So, I think in my whole time living in New York, prior to leaving New York, I think we only had like maybe one or two hurricanes, wasn't even that bad. Right? But I moved to Virginia and it was like hurricanes out of hurricanes, right? You think of Florida in the South, you think of the Midwest and tornadoes, right? So, it's what are the potential risks that are in your specific area? The response is the immediate response or the immediate aftermath of a disaster. So the hurricane happens, the tornado happened, the flood happened, the fire happened. So, this is where we're saving lives, we're protecting property, and we're trying to meet patients or people, clients' basic needs, right? So think of our basic human needs, right? So, emergency relief, emergency shelters. This may include like search and rescue operations, and then going in and assessing the damage. So like down here in Texas, one of the big things that occurred was we had the flooding, right? We had
Yeah.
flash floods that affected a lot of people. And I think the most, the news, of course, focused in on, of course, there was some youth camps that were directly like in the flood. So like what is the process of going and, recovering and assessing damage? And then recovery. So recovery is, how do we return to a normal life after a disaster? Um, and so if it's getting power and electricity back, you know phone lines, you know sorry, my husband just got home. Rebuilding, and then, the long-term support to the affected communities. And then, we have to look at the survivors too. So what is the psychological impact on the survivors, right? Um, and so a lot of times the different phases, the mitigation, the preparedness, the response recovery, they're going to um, kind of overlap, right? Continue in a cycle. Each one is going to influence the other. And so it just helps us to manage. The goal is to help us to manage disasters a little bit easier. So when we look at disaster planning, again, this is, developing a disaster response plan based on the most possible disease threats. So, or the most, yeah, disaster threats, not disease threats. It could be disease, but again, it depends on your area, right? Is it flooding? Is it hurricanes? Is it earthquakes? Is it tornadoes? Um, and so they're going, you look at, what's the community warning system, or, disaster warning system, how do we access communications, right? Um, and then, we, are going to identify like what, um, agencies are available, whether they're at the local, the state, or the federal levels to assist in, the disasters. And then we'll define the nursing roles, right? First, second, and third degree triage, right? And so basically, really, we want to know who's in charge and what is everybody's responsibility should a disaster occur. So, thinking of working in the community, you have a large amount of community volunteers, community nurses. What is everybody's responsibility should a disaster occur? So this was an example. I worked with Medical Reserve Corps. It's a volunteer agency. And so if a hurricane is occurring, or, we have the hurricane coming in, and so they'll activate us and they will tell us basically where to go and what to do, right? So a lot of what I did was man shelters, just make kind of, keeping peace and, making sure that people have their basic needs. We had emergency water, we had emergency food supplies, right? Um, so that kind of thing. Everybody has to have their, their known role. We need to know where all the supplies for the disaster management is, whether it's a hazmat issue, whether it's an infectious disease breakout. So again, it has to have, it's a detailed plan. If you're in a facility, whether it's a long-term care facility or a hospital, this is part of their plan too. They have to have so much water, so much food on hand should we lose power, right? We can't get supplies. We have to be able to feed the residents, right? Provide them water. And then, we want to look at, checking the equipment to make sure everything works properly. We want to evaluate efficiency, response times, safety. So this is why we do fire drills and evacuation drills and things like that, so that everybody kind of knows what to do should that occur. And then it's even going out there and telling the community. So we talked about, right, making sure that families have a response plan for fire, for hurricane, something, right? But this is like, making sure that they have their own disaster kit, or I hate that word, but that's like the one word that just comes to my head. Like they should have, like 3 days supply of food. They should have water. They should have like their medications. They should have clothing, personal hygiene, all like their personal documents, like those important documents, like birth certificates, passports, IDs, as well as first aid supplies. And so it's really cool. The CDC, the American, oh my gosh, the American Red Cross, you can go to their websites. They give you a list of like essential things that you should have as part of your emergency kit. Um, and then, again, how, what are we going to do within the community as far as that? Um, talked about that. All right, so disaster triage, let's practice. A nurse is triaging the victims of a disaster. Which color tag would the nurse assign for each of these four patients? So you have green, yellow, red, or black. So again, we're triaging. Oop, I love to highlight. So we're triaging um, each one of these victims.
Think I would give D the red tag.
The D would be a red tag.
I think so.
Okay, very good. So red here. I'll highlight this red. Oh, oh, I gotta hit enable editing. All right, so D is red. Okay,
I think I would give the child a yellow tag because he's a walking wounded.
okay. So a child who can't move his right leg but has palpable peripheral pulses, yellow tag. Okay. What about a middle-aged man who is ambulatory, has a laceration on his forehead?
Give him a green tag.
Which one?
I would give him a green tag.
Green tag. Good job. And then what about our frail elderly person with a severe head injury who is unresponsive?
A black tag.
Yeah, so I can't highlight it black, but yes, so that, yep, I agree with your assessment. So here you go. So a child who can't move his right leg but has palpable peripheral pulses. Yeah, it's a serious injury, right? But it isn't immediately life-threatening. They do obviously need medical care, right? But it's not like they need it right this minute, right? You're a middle-aged man who is ambulatory. He has a laceration on his forehead. Yep, minor injury. Again, not considered life-threatening. Um, and then, of course, our frail elderly woman with a severe head injury who is unresponsive. Unfortunately, with this, patient's unresponsive, has that severe head injury that usually is, especially with a frail, put that whole frail elderly person in there, right? Survival is probably unlikely given the circumstances there. And then the young woman with an obstructed airway who has struggling to breathe. Red, absolutely, right? That's an immediate life-threatening emergency, right? We have that obstructed airway that requires immediate intervention. Awesome. All right, so we get into epidemiology and all that wonderful stuff. So flu surveillance. So when we look at surveillance, what are we looking at with, epidemiological, with some of, what's the word I'm looking at? Looking at epidemiology, what would we look at when we are surveilling for flu? The word, I don't know why I'm like
I,
struggling to talk.
I think for the flu surveillance, I think it is on the broader scale. I know that generally, like the CDC tracks that because they try to make the yearly vaccine the current strain that is causing problems, like in the broader countries across the world. And I know they would give it in the fall to try to minimize the outbreaks that we'd have here to lessen the impact. And sometimes we do really good at predicting the strain, and sometimes we do really bad at predicting the strain.
Yeah. And that's the thing, right? Because viruses, especially the flu, evolve, right? And so they they change, and so it's hard to keep up with them because they adapt. Um, so it's keeping track of the morbidity and the mortality. Um, what can we, what are some, what's the impact on the community? What's SARS?
Severe acute respiratory syndrome. And I know that that's airborne, so we need our N95 and all of our standard precautions.
Hmm.
I know like people have like fever, chills, shortness of breath. Any respiratory problem could be a complication, so like pneumonia. I know
Right.
that these people are usually just kept hydrated and isolated.
Mhm.
Just maintain like the manage your fevers and the symptoms until it passes.
Very good. Yep. It's really not a whole lot, right? It is super spreading, like it can spread really quick, right? But it's, preventing the spread, making sure that we are using, good hygiene, right? Um, CDC reportable illnesses. So with CDC reportable illnesses, um, so the list is vast. Um, and so it's like some of your bacterial infections, like your anthrax, your botulism, measles, mumps, pertussis, trying to think, meningitis, um, your STIs, tuberculosis, I said measles, mumps, varicella is another one. Legionnaire's disease is also reportable. So, and then with viral infections, West Nile, your Zika virus. We haven't had a lot of Zika here in the United States, right? But we have had some. Um, your hepatitis A, your B, your C. Just trying to think of some other ones. Measles, mumps, rubella, they're viral, sorry. Um, Trying to think. Some of your parasitic infections are also reportable. Um, what else? Encephalitis. Trying to think. The best way to look at CDC or to, you're not going to know the whole, all-inclusive list, right? But um, if you don't know, you always go to the CDC website. And then, of course, you can go to your local health department website. But your STIs, your hepatitis, any of those communicable diseases are generally reportable to the health department as well as the CDC. Let's see. All right. So health promotion and teaching, infant death rate. So we look at infant death rate. What's a good resource for that?
CDC and the is it your state's women's health what's it called? I know here in Philadelphia we have like the Women's Health website, and they have like
Yeah.
information on like best hospitals, doctors, where to go, who to see, and the current
Mhm.
rates.
Yep. So yeah, your CDC, the Center for Health Statistics is another one. Um, and I know what you're talking about. It's some sort of institute of child health or something. I can't remember, but your CDC, your local health departments, your health statistics will all have that. What are some assessment oh my gosh, criteria for a client with obesity?
Um, so like their weight. I know now we measure the girth of the abdomen. That predicts a lot of like potential illnesses. We assess diet, activity levels, ethnic backgrounds, family history to see what a client might be predisposed to.
Hmm. And then we also want to look at what are some of the comorbidities that are associated with obesity. So, obesity has what's the word I'm looking for? Like, what are some of the complications that someone could have as a result of obesity?
So diabetes, hypertension, cardiovascular issues, kidney issues. The list is really endless.
Yeah, it is. You're absolutely right. It is, right? Your heart diseases, your stroke, your hypertension, peripheral artery diseases, the type 2 diabetics, the fatty liver, um, osteoarthritis, right, is a big one too, right? Because of the pressure on the joints.
Very, very.
Um, your sleep apnea, asthma, GERD, feel like there's more that you're right. The list is pretty vast. And we know that there's even certain cancers, right, that are related directly to obesity. Your
Colon
breast, your
cancer.
colon. Hmm?
Yeah, colon cancer.
Yep. Uterine cancer too, kidney cancer. It also, increases their risk of death. It could also lead to infertility, right? Which then can, take a combination, we also look at those psychosocial issues like depression, anxiety, right? Low self-esteem, social isolation. So there's a lot that goes in with diabetes. Lipid screening. What's the importance of lipid screening?
To monitor like your levels in your blood to see what you're at risk for, and like early screening for people who have the comorbidities like family history of heart disease.
Hmm. Right, because those high lipid levels, right, could, we think of patients with atherosclerosis. It increases their risk for heart attacks, for strokes, right? So, you know, identifying those high lipid levels, right? And then of course treating. Conjunctivitis. What do we do for conjunctivitis, sorry.
I know usually in home they're usually at school they get sent to the doctors. They at home they usually have like usually give eye drops. They're usually not contagious after 24 hours of using the eye drops. We use warm compress and wipe from the inner corner of the eye to the outer corner of the eye, and just general comfort measures.
Yeah, so they can go back to school right after they've been on the antibiotics for 24 hours. Big thing is hand washing, don't rub the eyes. Um, you know, not all the time. Oh my gosh, not people. I am struggling. I apologize. When we look at cross contamination, that's the word I'm looking for. So we want to try to avoid if we can, right? We don't want it to go from, one eye to the next, right? So trying, that's why, don't rub the eyes, don't touch anything, sharing of towels. We want to try to avoid that. I'm sorry. My brain just like totally just went out. But warm compresses, frequent hand washing, avoiding those shared. Again, they can go back to school after 24 hours. Viral conjunctivitis. Um, generally this one, there isn't any antibiotic that we can use for it, right? Biggest thing is, if they have any pain or if their vision gets worse, we want to make sure that they seek health care, to avoid any potential issues. Eczema in school sports. So what are some things, think about like your football players, your soccer players, lacrosse, all of those things. Um, you know, what are what is some skincare techniques that we can teach these kids to practice?
I want to keep their nails short so they're not picking and itching. Like moisture wicking clothing because the irritation. I think it's called. I think we do like ethanol treatments to like help in between like the sports activities.
I didn't hear what you said. I'm sorry.
Um, ethanol treatments just to control the flare up. So like if
Oh,
there's active flare, like that's controlled before this the activity.
okay.
Um, I
So
think
yeah, so we want to keep the skin clean and dry, right? Make sure that they shower after football practice, after soccer practice. Mild soap. So the pediatrician I worked with, he was a big Dove fan. He was like, Dove is mild, it's moisturizing, there's no dyes in it, right? So mild soap, and moisturizing. Want to avoid any sharing of any personal gear, as well as towels and things like that. Try to keep it at a minimum. What do we do for lead poisoning?
um, like when usually you monitor the lead levels and you remove like the what's causing the problem. the lead levels are high. I knew that we have, I think it's chelation therapy,
Mhm.
um, and just further education and monitoring. I do know that if there's any mental like disturbances that or issues that happen, that can't be reversed,
Mhm.
but there are adaptive like situations in like rehab that can like help retrain the brain.
Right, there are some adaptive. Yeah. So yeah, so obviously we're going to identify, by doing the lead levels. We want to also look at the some of the risks, right? So the older homes, any house that's built before 1978. It also can be present in the piping, right? So we have to look at lead pipes, not just lead-based paint, in the soil as well. So you're absolutely right. So, depending on what the lead level is going to determine the treatment that we are going to do for that child. How about working with high school populations? This is an interesting group of people. So, what are some of the potential issues that we see with high school kids or adolescents, I should say?
I think we see a lot of impressionable people, so there is like peer pressure, emotional distress, depression, like social health issues like within the family that might come out like outwards. We have like a lot of car accidents, a lot of like swimming without like proper caution. We have like drinking and ended up in bad situations.
Yeah, because adolescents are invincible, right? They can't die. So they're a little bit more risky in what their behaviors are, right? But
Yeah,
you're right, peer pressure, um, risky behaviors. We also, we could look at, unwanted pregnancies, right? We can look at um mental health issues, right? Some of these kind of come to life in our adolescence. Um, so what are some things, when we look at primary, secondary, what are some things that we can do with adolescents? Oh, obesity too is a big one. Didn't even forgot about that one, right? So what is some stuff that we can do as school nurses or people or as nurses in the community with the adolescent population?
definitely offering education on peer pressure, proper ways, like ways to like not succumb to certain things, education on like safe driving, using your seatbelt, um, not driving under the influence. We can also implement like screenings for STDs, setting up counseling sessions or group sessions.
Okay. Yeah, absolutely, right. Nutritional counseling, right? We can make community referrals, right? One thing about working with adolescents is, it has to maintain confidentiality, unless they voice that they are, thinking of hurting themselves or others, right? What they tell us, um, is confidential, right? But it's building trust with adolescents, right? We really have to work hard to build that trust and to gain their trust and then provide the resources that are out there for us about, reducing the risk, right? The education, identifying those risky behaviors and trying to kind of prevent them from happening. So what you said, right? Seatbelts, even safety equipment when they're playing their sports, right? The proper padding and helmets and all of that. Oh, I already highlighted this. I apologize. But a child has been diagnosed with bacterial conjunctivitis, which clinical manifestations would the nurse expect to note? Um, so itching, thought itching was one. But pain, itching, swollen lids, inflamed conjunctiva, watery drainage, crusting on eyelids, especially in the morning, right? So the swollen, infected, inflamed conjunctiva, the crusting on the lids. All right, so nurses reinforcing home care instructions to the parents of a child with bacterial conjunctivitis. Which instruction would the nurse give the parents?
One,
Okay.
3, and then 4.
All right. So 24 hours after antibiotics have been started, right?
Mhm.
So they have to have that full 24 hours. Towels and washcloths should not be used by other members of the household. And then when we do the crusted material, always go from the inner canthus to the outer canthus. This helps to try to prevent the cross contamination of the eyes. All right. The nurse is planning a program to promote secondary prevention for coronary artery disease. Which of the following interventions would the nurse include in their recommendations?
I think 1, 2, and 3.
It's one or it's just one.
Oh, just one.
Yep.
Then just one.
Yep. Lipid screening every 5 years if they are at low risk. Good job. All right, a community health clinic is offering a class about lead exposure and toxicity. Which information should be included in the class? And this is going to be a select all that apply.
Um, so 1, 2, 3, and I'm not sure about 4 or 5.
Okay, so yes. So with four, it can be a finger stick.
Okay.
There is a risk. All right. So there is a risk. So there, where it said there's no risk, that is incorrect. So you're correct. So yes, children in low income households are increased risk. Lead containing products can be inhaled or ingested, and blood levels can be obtained through a simple finger stick. Awesome, good job. All right, a child is hospitalized with the diagnosis of lead poisoning. The nurse caring for the child would prepare to assist in administering which medication? Of course, this isn't even on there.
I'm not sure. I want to pick the activated charcoal, but I'm not sure.
Yeah, I know it's kind of crazy. It's a dimercaprol is a chelating agent. Syrup of ipecac is a medication that we use to induce vomiting. Activated charcoal, this is like usually like for some of our medication and other types of overdoses, the activated charcoal, it kind of pulls and absorbs. So if there's like a lot of stuff still left in the stomach, it'll absorb it and then get rid of it. And sodium bicarb isn't going to have any effect. So yeah, so dimercaprol is a chelating agent that we would use. All right, so health promotion teaching, heart healthy diet. What are some things that we would limit with a heart healthy diet?
Low sodium, low processed food, low sugars, low trans fats.
Very good, right? So we want to do low sodium, low saturated fats. We want to increase fruits and vegetables. Um, what are some parts of an elder health assessment?
So I know we're gonna assess like their cognitive level, their mobility, assess for their medication, their visual aptitude, screen for depression, how well they're able to complete their activities of daily living.
Awesome. Right. And the goal is to try to maintain their independence as much as possible, right? Your depression screening is really important too with your elderly. Um, awesome. What's normal vision for a preschooler?
Um,
I know it's kind of a loaded question, right? So what do we do? When we think of health vision screening for preschool. Um,
well, I know they have like a modified smelling chart, right? Like they have pictures and colors.
yes. They have so they have like pictures exactly. So like I'm trying to remember my pediatric days, like boats and teacups and I forget. Been a while. So yeah, so we do have adaptable. We also have what we have the depends on the kid. We have like the E chart, which is literally just E's, and the E's are pointing in different directions. So like you can point to the chart and just have the child point like which way is the E going. That helps too, right? But it's important that we do the vision screenings, right? We want to help to, we want to detect any eye or vision problems early, right? So that we can, get correction. Because, that can if we can't see, right, that can impact their education, it can impact their development. Scoliosis. What is scoliosis?
That curvature of the spine, usually seen a lot like during adolescence when they start to have that growth spurt. Um, they can
Yeah.
have it can be functional scoliosis from like a heavy backpack or something like that, or just sitting always slouched. Um, I know they can have. I know when you see the school nurse, we have them bend over and we're looking for like whether or not their hips are even. They might have one shoulder higher than the other, ill-fitting clothing, um, just like off posture.
Cool, very good. Yeah. So we do the screening, you have them bend over, you look at their back, right? And then, of course, then depending on the symptoms and the severity of the scoliosis is going to determine, right, the treatment that we are going to um, provide, right? So braces, especially anything over 15 degrees, we'll start with that brace, and then kind of go for there. But it can, affect a lot. It can affect their ADLs, it can affect their respiratory status, right? So, try to fix what we can early. What are some of the healthy people goals or the healthy people 2030 goals for adolescents?
To decrease teen pregnancy, increase the number of graduates, um, increase like I know safe practicing and safe driving.
Yep, and then reduce obesity, as well as substance use as well. Sorry, it got dark. Turn on the light. So we talked about some of the, primary prevention for our adolescents, right? Trying to avoid some of those risk-taking behaviors, avoiding the alcohol, the cigarettes, the smoking, or I'm sorry, the drugs, um, unprotected sex, making sure they're wearing their seatbelts and other protective equipment, trying to avoid some of those high-risk behaviors that we know teenagers are really good at. No texting and driving, no cell phone use while driving. Um, let's see. Um, how do we evaluate community education?
Um, so I know you can do like little surveys to see what was helpful and what wasn't helpful in, for a community. You can evaluate what resources were used and how often they were used. You can look based on where you started in a certain population and see if the trends went in the correct way. Like if teen pregnancy decreased, or more people sought care or treatment for STD testing, or used the like free condoms program, things like that.
Okay. All right. Um, what would be some effective um community resources that we would provide to more of our rural areas?
Um, Telehealth visits, maybe like a day where like you could have a mobile unit go out to do vaccines, screenings for depression, um, educational items, resources.
Right. So when we think of some of those rural areas, right, the lack of access to healthcare is a big part of that, right? They're less likely to participate in any of those prevention measures, right? They have higher rates of obesity, diabetes. They have higher infant and morbidity rates. They have increased risk for trauma and accidents, right? We think rural, we think farming, right? They also have higher rates of suicide. Um, Again, they're less likely to seek preventative care. They also have the risk of pesticide exposure, sun exposure, other chemical exposures, right? So there's a lot of things that we can do, so like you said, we can do more of, we can do telehealth, maybe, looking at what other types of outreach can we do? Because the priority needs for that population are going to be your cancer prevention, your mental health care, your substance use prevention, immunization programs too, family planning, right? And just kind of making sure that they have, they are using and have access to the safety equipment that they need as well. um a lot of times too, they may not even, they don't do the prevention. They may not have access to healthcare. They may not have the money to pay for healthcare, right? Depending on um their situation. So there's a lot of needs that that we can provide for those in the rural, whether it's, I always think of like the mobile healthcare units, right? You see them all the time in the city. I always thought that was interesting, right? I see 'em when I was in Virginia, I saw them all the time in the mobile MRIs and the mobile blood banks, and they have like all these mobile clinics. Like, go to those rural areas, right? Get some providers out there and talk to some of those, seasonal, the rural, the migrant workers, those kinds of people. Um, what are some teachings that we can do for skin health?
Assessing like your skin for like uneven moles or sores, assessments for like previous skin conditions like eczema, um,
Right.
instructions
And
on like
then,
unscented soaps, using like washcloths, loofah, not sharing those items.
yep. Making sure that they're using sunscreen, protective clothing, right? Long sleeve shirts, avoiding the hottest times of the day. Don't go out in the sun during like what is it, 10 a.m. to 2 p.m., right? Those types of things. How do we reduce the frequency of urinary tract infections?
Proper hand hygiene, wiping from front to back, and using increasing like fluids, wearing looser clothing.
Urinating before and after sex is another way to reduce urinary tract infections, especially in women. Um, what are, when we look at food stamps, we look at WIC and Meals on Wheels. WIC is women, infants, and children. Generally it is income based, right? But it does provide nutritional food. Um, and even for, like not just for mom, but once up to, what is it, up to age 5.
Yeah, stage
So
five.
like they get formula and stuff within that first year, and of course milk and other products up until age 5. There's also food stamps, or is it TANF now? Is that the proper, is it temporary assistance, or I can't remember what it's called.
It's still
Um,
stamped here.
I'm sorry.
Still stamped here. Supplemental Food Assistance Program here.
Oh, SNAP,
Yeah,
SNAP.
SNAP.
That's it, SNAP. What's TANF? Now I can't remember what TANF. Um, but yeah, so um, you know, when we look at, some of our lower incomes family, making sure that they know about what the resources that are available to them. WIC also does like nutritional help, they do like the hemoglobin screenings as well. So lots of resources there. They have like some educational programs. I just remember WIC because um um when I had WIC for my kids when they were little, and so they like had some really good resources. Meals on Wheels. Um that is another really good resource, right? Especially for some of the like our elderly population, right? That maybe are more, less mobile, they can't get out of their houses, they have more difficulty preparing their foods. Or, just in general, our elderly population are at risk for malnutrition, dehydration, right? Certain deficiencies. And so that's another way, right, that we can make sure that they are getting what they need. Um, Home health, home health, they have to have the skilled need, right, in order to qualify for home health. So there's a variety of different, to really kind of just depends, but they have to have that skilled need with home health. Um, So, heart failure, the biggest thing is that we worry about with heart failure is the weight gain, the shortness of breath. We're looking for any edema, as well as like increasing fatigue. Um, they, what are some, when we look at, some of the things that we can do for home health care, a lot of it is, you know, monitoring their respiratory status, making sure that, they're following their recommended diet, daily weights, low sodium diets. And a lot of your heart failure patients will also be fluid restricted, especially if they retain a lot of fluid, making sure that they are compliant with taking their medications. What are some considerations when we look at NG tubes?
As the community health nurse or just in general?
In general.
Obviously, the placement, ensuring that they are, flushing that tube in between feedings and in between medication insertion, um, ensuring that they're replacing the port as it needs to be replaced.
Yeah, absolutely. That we're monitoring their residual as well, right? Keeping their head bed elevated 30 to 45 degrees to prevent aspiration, making sure that they are getting their nutrition through, appropriately through that NG tube. Respite care is something that is offered for caregivers of, chronically ill. Um, think of, like parents taking care of chronically ill kids, or even taking care of like your, chronically ill or older adults. It does help to prevent or to well, it does help to prevent caregiver role strain, fatigue, and stress. And so it's just temporary care, right? And that can be done at home. It can be done in a facility. Um, what are some risks for falls at home?
Or lighting, cumbersome house, lots of clutter, wearing like your favorite pair of bed slippers and not wearing correct footwear, not having grab bars, having a whole lot of throw rugs.
Yep. And then of course, we think of people that have like unsteady gaits and, using walkers and wheelchairs and things like that. Um, yep. So removing the hazards, right? Installing grab bars, handrails, that kind of thing. Um, Suspected abuse or reporting abuse. So the assessment that you're going to do is going to be age related. Right. There's a variety of, depending on the age of your client, is going to, help you to kind of see what some of the um assessment parameters would be. But it can be anywhere from like poor hygiene, skin breakdown, bruising, fearful behaviors, inconsistent histories with your, injuries and things like that. Um, and so biggest thing here is to, follow that you're reporting laws in the as well as the organization that you are working with. And again, it depends with an adult, right? We have to have that conversation with an adult. We generally don't just report, right? Because we have to make sure that they have a safe way out. Children are a different story. Um, Home care assessment for a below the knee amputation. Biggest thing that, we're looking at the stump and how well it's healing, if there's any irritation or issues with that. One of the big concerns with clients that have, amputations is your phantom pain. So offering, there's different techniques for phantom pain as well. Mirror therapy is a good one. Basically it's like showing your brain that that part of your body is not there anymore. And it has helped. It's been effective for some. But big thing is, inspecting that stump daily, making sure that they are, whether it's a stump shrinker or if it's a compression bandage, making sure they're doing range of motion. And then hopefully eventually they'll get their, what do you call it?
Prosthesis.
Prosthesis. Yes. With COPD and ADLs at home. So, think about it. If you can't breathe, it's hard to do things, right? It's hard to get up. It's hard to cook, clean, eat, drink, all of that stuff. Go to the bathroom. Um, and so it's balancing rest and activities, right? Get up and do something, take a break. We can also teach them some of those breathing exercises, like the pursed lipped breathing, small frequent meals, because with our COPD patients, they're usually very tiny, they're usually malnourished. Again, it's because they have more difficulty eating and drinking. um, so, kind of just teaching them some interventions to try to get what they need to get done, reduce the stress and the work of breathing. A lot of them will have like oxygen therapy at home. Cirrhosis, ascites. So with ascites is fluid retention because of the liver not functioning appropriately. And so ascites is, they get a lot of fluid in their abdominal cavity. Um, so the biggest thing with that is a low sodium diet, as well as fluid restrictions if needed as well, and then avoiding any medications or anything that's going to affect the liver, right? No alcohol, no acetaminophen. Um, and then home safety following an arthroplasty. So there is obviously going to be a risk for injury, depending on the age of the patient too, right? There's a lot of different factors that are going to come into play. And it depends on where is it a hip, it is a knee. Um, and so again, it's a lot of the same safety, right? Removing the throw rugs, making sure that they can get through with their walker, their crutches, their wheelchair. Um, I will tell you, raised toilet seats are very effective, especially with knees and hips and ankles. Trying to get all the way down onto a standard toilet can be a little bit extra stress. Avoid crossing their legs, maintaining, making sure that, if they're reporting if there's any, numbness, tingling in the lower extremities, any, cool to the touch, that kind of thing. Um, Post cabbage, um, this is, diet, exercise, stress management. There are some cardiac rehab. A lot of times they'll go into like a skilled care facility and get some cardiac rehab as well as, PT and OT as well. So I feel like I've kept you on here for like over an hour. All right. So which of the following tertiary interventions would a home health nurse implement for a 65-year-old who has been discharged from the hospital after coronary artery bypass graft? So recommend the patient follow an eating plan like the DASH, arrange to have a colonoscopy, refer to a cardiac rehab, reconcile previous medications with discharge meds, and provide a brochure on how to prevent heart disease.
And say 1, 3, 4, and 5.
So 1, 3, and 4, they already have heart disease. They've had if they've had a
Oh,
cabbage, but
okay.
yes. Yeah, eating plan like the DASH diet is perfect. Cardiac rehab, right? And definitely reconcile those medications. Good job. Um, and so risk factors for HIV, unprotected sex, men who have sex with men, those that have multiple sex partners, your IV drug users, are going to be at your biggest risk factors. What are some secondary prevention measures for sexually transmitted infections?
That is going to be the screenings, the testings, the
Yes,
I
good
think that's
job. Um, Screenings, testings, awesome, good job. Because we want to get that early treatment, right? Early diagnosis, early treatment. Um, Hepatitis B, your risk groups, your healthcare workers, your IV drug users, prevention, hepatitis B vaccine. Like, can't tell you how important that is. With hepatitis A, this is your fecal oral route. So, can spread through contaminated food, water. So safe food handling, hand washing, key factors in that. Your risk factors for pelvic inflammatory disease, unprotected sex, history of sexually transmitted infections, multiple sex partners, can be it's very painful. It also increases the risk for infertility if it's not treated, as well as other reproductive complications. Um, so risk, kind of how do we control those risk factors, right? Um, Condom use, safe sex practices, right? Some of the other things that we talked about, like even with, preventing urinary tract infections, right? Um, and lots of education. Um, Tuberculosis. Um, what is tuberculosis?
it is a bacteria that settles in the respiratory tract and attacks the lungs, creates pockets. People have that low grade fever, night sweats, um, hemoptysis. They usually end up on a course of treatment for like 6 months to a year of like rifampin, INH, pyrazinamide. I'm going to teach them about the side effects of those drugs and that they must complete the course.
Awesome. Yeah. Okay. Um, so we do the PPD first, right? If the PPD is positive, then we do the chest X-ray. But definitive diagnosis for tuberculosis is always going to be that sputum sample. Um, all right, we did it. I'm sorry. I didn't mean to keep you on here for so long, but um
Thank you.
I can just keep this or I can share it. It's up to you because I know like you're the only one that showed, so it's up to you. Or do you want
Uh,
me to just share it with you or I can share it with everybody?
it doesn't matter. I don't mind.
You don't mind? Okay.
Yeah.
So I might just post it for everybody.
Okay.